Welcome to the training video for patient equipment transfer trolleys and other transfer equipment. This video has been designed to describe the key processes required in ICU transfer at MBT and to introduce the PETTs to you. The video will take just over 5 minutes to work your way through and should be used in combination with the SAP. There are several pieces of transfer equipment that you need to be familiar with: the transfer bag, the transfer drugs, and the equipment transfer trolley. The transfer bag is laid out in a logical order and each pouch is sealed. It allows you to deal with most common emergencies. The transfer drugs bag, kept in the fridge, contains drugs that are most likely to be used. The patient equipment transfer trolley is designed so that you can use all the equipment on it without having to remove elements and put them next to the patient. It also has sufficient oxygen to manage all transfers. The transfer trolley itself starts at the top and has mounts for our monitors, our ventilator, and our syringe pumps. To fix the syringe pumps on, you need to stack them or bolt the Alaris pumps to the additional vertical handle. The ventilator is secured and does not need to be moved. The monitor can be removed by pressing the button underneath the Philips logo and lifting it vertically. There are drip stands on each side of the trolley that can be moved by unscrewing the black knob and moving either the mount or the drip stand itself. There are two HX size oxygen cylinders as well as a CD cylinder. Use the HX cylinders in preference and use them until they are empty. When they are, place one of the empty O2 cylinder labels on them and ask the porters to change them. The cylinders should be rotated so that you can access the Schrader connectors in the orientation as you can see. Adjacent to the oxygen cylinders is a dedicated space for the transfer bag so that you do not have to carry it. There are plugs for all the devices, and this enables the PETT to use a single wall plug to charge everything. Above the shelf, you can place the transfer drugs, and there is also space for portable suction. To connect the PETT to the bed, first remove the end of the bed and hang the mattress inflator on the frame. Then choose the correct connector and attach it and screw it down. There are two connectors, one for each type of bed that we have on ICU. The standard connector for the CareTech bed as shown, and the additional bar which connects the bed and to the standard connectors for the Lannett. In order to connect the PETT, lift the connector up to the right height and connect it directly to the bed by dropping it into the hole. You might have to use the additional bar for the Lannett beds. Once it's connected, screw it down so that it is secure. There will be some lateral movement, and this is normal and safe. There are a couple of commonly asked questions that I want to address. The first is that the bed and PETT fit in the lifts. We've checked, and you can get round the head end easily. The second is that there is sufficient room to extend a normal infusion line and the ventilator circuit all the way from the PETT to the end of the bed as demonstrated, and this is safe for an internal jugular central line, although you may have to be careful with shorter infusion lines such as those for TPN and propofol. One of the greatest challenges is the cable spaghetti that we often cause. We're going to adopt the retrieve method, so start at the monitoring block. Ensure all your cables are connected and then tie gloves every 30 to 40 centimetres. This is really easy and takes about a minute to do as long as the cables are available. As you work your way down the cable umbilicus, make sure that you let the saturations probe come out after 2 sets of gloves and the CO2 sampling line after 3 sets. It's that simple and it saves so much time. When you get to CT, Ensure that the CT table is fully extended. Match the height of the bed with the table, and then perform a lateral transfer as normal. Disconnect the PETT from the bed, move the bed to the right, and then disconnect the oxygen from the cylinder and connect to the wall. You will be able to locate the PETT as shown. Keep an eye on cables and infusion lines as the corners of the PETT may snag them. After use, you need to clean the PETT with Clinell wipes. Check that the oxygen is sufficient, so that is 1 full HX and 1 in use, and a full CD cylinder, and then you need to check the transfer bag and transfer drugs and clean these as well. When it's returned to its location of storage, please plug it in. Thank you for watching this video. I hope it has been useful. If you have any feedback or any further questions, please get in touch.